Hello, this is Dr. Robert Bouvier with Dr. and You. You came to this video as a business person to learn a little bit more on how to integrate non-traditional health care into your benefit plan. So you're going to ask yourself, why would I want to do that, right? Well, statistically, over the United States, we've gone from 10 years ago, 30% of the population seeing some form of alternative care to now in upwards of 70% of the nation's population has seen some form of alternative, complementary, non-traditional health care in the last year. And it's been estimated, and I can substantiate this with quite a few of my patients when I audit it, that 20% of the people, of that 70%, 20% of the people who have seen an alternative practitioner over the last year, 20% of those people actually prefer or call that practitioner their primary care contact or their primary care doctor. It's a huge issue in healthcare today, and it's been a needed issue. It's always been kind of a fight between traditional and non-traditional medicine practitioners. Who has the right to treat this patient? And from my perspective, it's the patient's choice. We do live in America. It's the patient's choice as to where they want to receive care. If they take educated and understanding of what's going on. So what do we talk about? We're talking about chiropractic, acupuncture, naturopathic, homeopathic, and other forms of we'll call it lump it into non-traditional health care. I'm not going to get into the debate of what's right, what's wrong. It's just statistically, as an employer, you should know that 70% of your employees have probably seen some form of non-traditional medicine. And for you employers who would like to bring that in as a benefit, you can, with high deductible health plans and health savings account, flexible spending accounts. You can actually take what has been a problem for you with the Accountable Care Act or healthcare reform. We can turn that into a very positive and use that health benefit to keep and get very good employees and keep them because your health benefit is so good. I know the cost has skyrocketed, the quality has decreased with the Accountable Care Act, the AKA Obamacare, but as an employer, you need to know that if you do it right, if you offer the service right, you can actually improve that benefit dramatically and be a step ahead of your competition in the whole realm of not breaking the bank at a cost that you can afford. And let me give you an example. This was about 10 years ago. I had a patient owned a medium-sized business. He was spending about $1,700 per month per employee for their health care, their health care benefit. It was mainly a traditional plan, and we came in and inserted telemedicine and mobile health, came to the work site, and because we came to the work site, identified a lot of wellness prevention, and we were taking care of that. The cost of that premium actually went down by nearly 7% that first year. 3 years after we'd been into the system for a while, he came to me and said, we got to decrease this cost, the cost is killing me. So we were able to go from $1,700 per month to $400 per month for a high deductible health plan. In addition to the $400 a month, we added a $500 a month cash incentive in the form of a health savings account, and you can learn more about by Googling HSAs and flexible spending account, which are two different things. And this particular guy actually offered both, or three things: the high deductible health plan at $400 per month, the HSA at $500 a month, and the flexible spending account. So we went basically from $1,700 per month total cost to $900 per month total cost. And what was interesting, the employees came to him and said, thank you so much for changing, because their out-of-pocket actually went down in many cases to zero. With the traditional health plan, the premium at $1,700, many of the employees were spending $2,000 to $3,000 more a year on the copays and deductibles. The employer didn't really realize this. With him paying for the health savings account and flexible spending account as well, they didn't have to spend their own money, and many of the employees came and thanked them for that. When was the last time an employee came to you and thanked you for their health benefit? But we were really able to impact not just the cost for the employer, but we improved the healthcare benefit package for the employer. In addition, the quality incentives, or the quality items that we looked at for diabetes control, blood pressure control, cholesterol control, and wellness went right through the roof. The national average is 30% on those quality measures, and they were routinely hitting 80% plus in those wellness measures, just virtually unheard of. And we see this a lot when employers go to a high deductible health plan coupled with HSA and FSA. So by them, the employee now can take that health savings account money, flexible spending account money, and actually spend it on alternative health. Now that's back then. What's going on now is that we're seeing employers actually wanting naturopaths, homeopaths, hypnotists, chiropractors, other non-traditional healthcare to come into the workplace, and through telemedicine, mobile health, we're able to bring that actually into the workplace and make it available at actually a reduced cost as well. So we can really impact your employees' health, improve the quality, decrease your cost. At the same time, we can offer another part of non-traditional healthcare that your employees are looking for. So if you have any questions, please come to drandyu.com. You might get a few of those questions answered, or you can call us directly at 810-610-7972, 810-610-7972, or email me directly, robert@robertbouvier.com. That's Robert at ROBERT, B as in boy, OU, V as in Victor, IER.com. Again, this is Dr. Robert Bouvier talking about how to bring alternative, complementary care, non-traditional health care to your employees as a health care benefit. If you have any questions, please give us a call. Thank you very much.